Today I want to talk about the most undertreated injury of the lower extremity, and that's what's considered the common ankle sprain. Now, essentially what happens when you sprain your ankle is you turn your ankle like this and you end up ripping or stretching two ligaments that sit here and here. Now, the problem with this injury is that over 50% of patients that sprain their ankle will develop a condition called chronic lateral ankle instability if it's not treated correctly. That means if it's not treated correctly, you will develop chronic ankle sprains over your life. And by chronic, that can just be 1 or 2 a year. But if you keep doing that steadily over time, you're eventually going to end up with arthritis in your ankle joint. So that's something you definitely want to avoid. The good thing is there's been a tremendous amount of literature and a lot of research on how to best treat ankle sprains over the past 10 or 15 years. And it's very clear how it should best be done. So number one is in the first approximately week to 2 weeks, we're going to immobilize you. That means we're going to put you into a walking boot like that. Now, depending on the degree of injury, it may just be for a few days, but it may be up to a couple weeks. After that, we're going to move you into an ankle brace. Now, usually we can start you on rehab exercises after the first week or so. Those are usually one leg balance exercises. And again, the research is very clear on what's the best type of injury for this. And then once we can move you out of that boot into an ankle brace, even though you're wearing the ankle brace, you can usually start back to full exercise activity quite rapidly. But you have to protect this thing and you have to prevent further injury to it. So I think the number one thing I can say as a take home on this is if you do sprain your ankle, see a podiatrist who specializes in sports medicine, get it evaluated, make sure there's no fracture involved, make sure the right ligament is being treated, and that you are getting adequate treatment. Part of the problem is when you go to, for example, an urgent care center or an emergency room for this problem, often you're put on crutches, which is one of the last things you should be doing. We actually want to see you bearing weight with this problem. So go to see somebody who really knows what they're doing, get it treated correctly, and make sure this does not become a long-term problem for you.